In this session, we will learn about making decisions and solving problems. No matter what our role in nursing, we are constantly involved in making decisions and solving problems. The learning objectives for this session are to apply strategies to strengthen the nurse's role in decision-making for patients, explain how problem-solving, critical thinking, reflective thinking, and intuitive thinking relate to decision-making, and evaluate the common barriers to effective time management. All of us have made decisions and solved problems in our personal and professional lives. What then is the difference in these two topics from a leadership and management perspective? That is the focus of what we are going to discuss. Not all decisions begin with problems. Before a problem is presented, we often have multiple choices for action available to us. For example, a nurse leader might engage a group in making decisions about how future nursing care should be delivered. There is no problem to be solved here, merely opportunities to think creatively. Problem solving basically involves names. Problems are staffing shortages, insufficient supplies, too many assistive personnel, and so on. Problems are immediate choices to be made, and they are usually based on closing the gap between the reality and the desired. Although one way to solve a problem is to reframe the desired, usually the real choice is to alter the current reality to better approximate what the desired state should be. There are two types of decisions. The first type is known as satisficing. This is when good enough is the right answer. For example, if two products are essentially the same and one is more expensive because of some extra dials and knobs that aren't essential to quality care, a satisficing decision would be appropriate. On the other hand, if you are hiring a new evening staff nurse and this person has to perform at a high level of quality, the decisions for shaping the advertisements, the recruitment plan, and the interview process need to be optimizing because you want the best possible person. The two types of decision-making styles often reflect your management leadership style. An autocratic decision is one where an individual decides and announces the decision. While this may have to happen in some situations due to confidentiality of information, it is usually not as effective as a democratic style. That style requires group input. While a decision may look attractive from one perspective, it may be a nightmare from another. The value of having multiple views is that the decision usually fits more people's abilities and needs than if someone decides alone. If a decision is not going to be one of high quality, why waste the group's time? Even if all cannot embrace a decision, they should be able to at least accept it as a sound one and advocate for its implementation. Here are some characteristics of good decisions. Information is factual, complete, and relevant. Decision makers processed the data. The decision is defensible. The benefits outweigh the liabilities and risks. There is a fit between the decision and the original need. So let's turn now to problem solving. Answering these questions can simplify some decisions. For example, if the answer to the 5 first questions is no, you have to decide what to do next. While we don't often think about ignoring the problems, that is an option. Ignoring can also be thought of as purposeful inaction. Refer might include giving the problem to your boss or someone else who has the authority to solve the problem. Delegate suggests that you expect to stay involved in the process, but that someone else will have the responsibility for the solution. Consult is the strategy when you want or need to stay involved even though you don't have the authority to solve the problem. And collaboration is analogous to group participation in decision making. The decision-making process is one that is probably familiar to all of us. The difference in a leadership or management position is the nature of the problems we are dealing with. First, we may be looked at as the expert practitioner on the unit, so some of our problems may remain clinical ones. Second, we are now accountable for others, so some of their problems may become ours. For example, if the nurse providing care for a patient needs to monitor IV medications and no IV pump is available, it is the leader or manager's job to secure the equipment or problem solve with the staff to determine how to proceed with IV medication administration for this patient. Making decisions and solving problems are not the same processes. However, both involve critical and creative thinking and are focused on answers that are either the best possible or good enough for the question under consideration.